we've got a few jobs to do for the winter. So we've got the wheel off now, and we're going to go have a look at the tie rod bushings and the steering construct. So this is the tie rod and the tie rod bushings there. That bushing, should you get a split or a crack or wear in that bushing, that leads to instability of the wheel and abnormal camber. So that's like your labrum of your shoulder. A tear or a rip in that leads to instability. If we think about our two cases, the two athletes that were the same age, had the same rugby injuries. Our first case had a soft tissue injury, no bony loss. We could consider a soft tissue stabilization purely based on the pathology alone, but we also need to think about the other factors. Such as his level of sport, his profession, and the time of the season and functional demands. So for an amateur athlete, where this is not his profession, perhaps you could think more about a soft tissue procedure. Whereas if this was a professional athlete, it was the end of the season, and you want to make sure that you give them the best chance with the lowest recurrence risk, then I would be tempted towards a Latarjet procedure. But you need to think about the complications as well, and that's really where the discussion comes in with the patient. The second case, again, you need to think about the type of patient it is. How important is his sport to him? This is a first dislocation. Does his enthusiasm to return to rugby outweigh his attitudes towards the risks of surgery? So he may wish to consider stopping playing rugby, and then his recurrence risk is less. We know that his recurrence risk is very high with a bony injury, and even any size bony injury, so therefore we'd be tempted to surgery for him. Being an amateur athlete, we know from a couple of studies that the results of a of a direct bony repair can be successful if done acutely, so therefore he would be a good candidate for this. If he was a professional athlete, my tendency would be towards a primary Latarjet, even for an acute injury, as the recurrence risk appears to be less, with a much stronger stability, or I call it a stability adding procedure. But again, that needs to be balanced against the risks, which we know are slightly higher with a Latarjet procedure. So therefore, as we see, it's really important to consider all the factors, the patient factors, the pathology itself, and also the pressures and the participation, the other factors are involved. And I think all of them are equally important. The pathology is one of these factors. I hope this has been clear, and hopefully you also have seen the relationship between tie rod bushings and the labrum. Thank you.